Many of you probably know my wife Sabrina's story, which is that Dr. McDougall saved Sabrina's life. Sabrina, 15 years ago, had a rare autoimmune disease called relapsing polychondritis. She was under the care of a rheumatologist who and was getting a lot of heavy medication, and it wasn't very pretty. And then she read Dr. McDougall's book. We changed our diet, and the next of her monthly appointments, she was normal for the first time. Her SED rate, the anti-nuclear antibodies weren't present. After 3 months, the rheumatologist said, "You're in remission." And so we've never looked back. We have a lot of gratitude, speaking of gratitude, towards Dr. McDougall. And, you know, I think Dr. McDougall has saved my parents' life as well. He's been so incredibly kind and helpful to them in a lot of ways. And I know that, that there are so many people who are in this business, speakers here and people that are helping other people, who owe a lot to Dr. McDougall as well, that he's touched and inspired a lot of people who then gone on and found their way, done their studies, treated patients, and taken this information that they got from John. So I think if John were sitting on a big MLM scheme of gratitude and all the thousands of people he's helped and all the people he's touched and the thousands of people they've helped and the thousands of people they've helped, he'd be able to buy Google probably at this point. It's really true. James, let's look at the video.
In the early 80s, as I started getting really serious about this, you know, the work started coming out from Nathan Pritikin and John McDougall. And so those two had a big influence, and especially John McDougall. John McDougall had a big influence on my life because, you know, I was doing this from the alternative side. I didn't want to join the system. You know, I wanted to beat the system. So I was like, you know, doing things on the side as an alternative health practitioner. And what John did for me was he showed me that there was actually a lot of benefit from going into the system and trying to change it from within. So he was, for me, like the first doctor that I knew who actually went in and was making a giant impact.
Well, my strongest influences in medicine are people like John McDougall.
I was heavily influenced by the work of John McDougall.
And I mentioned I read and was influenced by, I think, John McDougall's first book, the McDougall Plan.
Of course, one of the coup de grace of the whole thing was at the end of my schooling, I got to do an extended internship of my choice, of an area that interested me. So I chose to go spend it with John McDougall at his center out in California.
Ladies and gentlemen, please welcome John McDougall.
All right, thank you all. Thank you. Thank you very much. Well, that introduction is appropriate for the talk that I'm going to give here in a few minutes. But before we start, I would like to introduce the other half of the McDougall program. Mary, could you stand up and say hello? Yes. It's been 39 years, and still moving forward in our relationship and our chance to work together. We were just talking. I was talking yesterday to my daughter, who works in our business, and she's concerned. She's concerned because Mary and I are getting older. You know, and that's just one of those things that happens in life. And I said, look, the business will continue because, you know, the business is an entity in itself, and you'll continue to run it as administrator, and your brother, my son Craig, will run it as the doctor. I mean, you know Dr. McDougall here. You wait till you see the next Dr. McDougall. He's amazing, absolutely amazing. Anyway, it's good to be here among so many friends. I try and remember most of your names. If I've seen you as patients, I do remember your cholesterols. But, I'd like to talk to you. It's so appropriate that Jeff gave kind of this pyramid of how things happen in life. Well, I stand on the shoulders of many, many great people. Nathan Pritikin was mentioned. Walter Kempner is another one of my heroes. But one of my heroes that I got to know pretty well, and I want to share with you, is the man who discovered the treatment of multiple sclerosis with diet. And in honor of our friendship and the professional things that he did for me, I set up a foundation about 5 years ago, the McDougall Research and Education Foundation. I raised, through some generous people, I raised about $750,000. And I decided to dedicate that money to the dietary treatment of multiple sclerosis. Mary said, why? Why would you do that? I mean, who has multiple sclerosis? There are only about 350 people in the country that have multiple sclerosis. Why don't you do it for rheumatoid arthritis or heart disease? I mean, good grief, 1.25 million people have a heart attack every year. Why don't you study heart disease? And I said, no, I want to study multiple sclerosis. And the reason is, well, one is for my mentor, who I'm going to tell you about. But the other reason is because I want to take the biggest rock I can find and throw it at the biggest picture window in town. I mean, if I can stop multiple sclerosis with a simple diet, they're going to say things like, wow, I bet it can cure constipation. Or maybe have a positive effect on cancer and heart disease, diabetes, and so on. And people think of multiple sclerosis as some really distant disease that nobody understands. It's a mystery. It just kind of happens. Multiple sclerosis. Well, I'll tell you a little bit about what it is. If you don't know about multiple sclerosis, you're going to enjoy learning about it, and you're going to enjoy learning the relationships that multiple sclerosis has to other diseases. The story, the saga, it ended when my mentor died, and that was on November 16th of 2008. His name was Roy Swank. He was the head of the Department of Neurology at Oregon Health and Science University. That's where my son is in training. Actually, he's a medical doctor. He's a medical resident in the internal medicine program at Oregon Health and Science University. We just kind of call it the medical school in Portland. And he died on November 8th, and the beginning of the story, the new beginning, started in January 15th of 2009, when I got approval from the IRB of Oregon Health and Science University to run the diet and MS study. It was one of the hardest approvals that anybody ever got. It would have been easier to get a drug approved that didn't work and made people violently sick than to get approval, ethical approval, to feed people vegetables. It took me 1.5 years for them to say it was safe to feed people potatoes and rice and corn. But they finally did. They finally, after all the nonsense, they finally gave us approval January 15th, 2009. And that was the approval for the diet and MS study that I run. Let me tell you, when I started that study, I sent the head of the neurology department, Dr. Dennis Bourdet, I sent him a note, just a short, just one paragraph note. And I said, there are going to be 3 things about this study for it to happen that I request. One is that every paper we publish has Dr. Roy Swank's name and description in the introduction and the discussion. Every paper he gets credit for the work that he did. I said, 2, I get to train the people, the participants. I get to teach them how to eat their diet. Because the biggest problem with any kind of study is compliance. And the best chance I felt I had for compliance was to lock them up at our 10-day program, which I've been doing. And the third one is I asked that my name not appear on the paper. Okay? Because if it did, then people would say, oh, that's just one of McDougall's things. No, the names on the paper will be the head of the neurology department, the principal investigator, Dr. Yadav, and other people who have worked on it. But you'll look at these papers and you'll say, well, Dr. McDougall's name's not on it. That was at my request. Dr. Swank and I were good friends. I used to sell books. That's how I made a living, was selling books. And when I would go to Portland, I'd visit with him. And he gave me a book one time. It was published in 1959. Now, 1959, I was 12 years old. And in that book, he said what the things that you and I know right now. He said gluttony and chronic diseases have been linked in the minds of both laymen and scientists for many years. The saying, to dig your grave with your teeth, probably has its origin in antiquity. But in the prosperous areas of the Western world, during the past few decades, the maxim has taken on real and tragic meaning. That was 1959. This is 50 years later. Nothing's really changed. Multiple sclerosis. This is a fun disease. I mean, the surprises are tremendous when you have this disease. One day you may wake up and you can't move one leg. A few months later you wake up and you can't see out of one eye. And then another time you wake up and you can't urinate. Another time your bowels don't work. Find yourself stumbling around. This is a disease where the body attacks itself. It's called an autoimmune disease. And it attacks itself right around the blood vessels. It's called perivascular. So something in the bloodstream comes through the bloodstream and attacks the brain. And when it attacks the brain, it causes the brain to be inflamed. You know, just like if you burnt yourself or you had to hit yourself really hard, what would happen is the area would become inflamed and swollen. And the attack is so serious that some of the cells that get attacked actually die, but some of them recover. So the patient is really, really bad for the early days of the attack. Blindness is complete and the paralysis is complete. But it comes back. Not 100%. It comes back somewhat over the next month or so. And the way you diagnose this disease is that the attacks are random. They make no sense at all. It's like an inexpert marksman shooting at the nervous system. Boom, something goes out here. Boom, something goes out there. Boom, something goes out there. And you can see these, the scars. Sclerosis means scars. The scars that are left over. See these scars here, these white areas? These scars right here? Yeah, that's the end result. Multiple sclerosis, multiple scars. That's what it means. Now, anybody who has multiple sclerosis, they're put into categories. We do that as doctors. When you have diseases like arthritis, we put your arthritis into various categories. We call it like rheumatoid arthritis or psoriatic arthritis, lupus arthritis, nonspecific arthritis. Yeah, we put it into these categories. And you as a patient, you're really happy because now the doctor knows what you have. And somehow that's to help the doctor better treat your problem to get you out of trouble, but it really doesn't. They're just categories of diseases. Doctors do that. The causes are the same, the treatments are the same, the results are the same. So if you just, when it comes to arthritis, for example, I call it inflammatory arthritis, whether it's lupus or whether it's rheumatoid or psoriatic, et cetera. It's the same thing with multiple sclerosis. Doctors like to put people into categories. And there are two general categories that they talk about. One is relapsing remitting, which is the one they say is helped by medication, and that is not as severe, relapsing remitting. And the other is progressive. And you kind of get an idea of what we're talking about here. Relapsing remitting, in other words, people have attacks and then they get better. The other kind is they just go progressively downhill. Actually, it's the same disease. It's just that those who have progressive, they skip the relapsing remitting phase. But somehow the patient is either given hope or despair by the fact that the doctor will put it into various categories. Irrelevant, useless, and actually harmful, particularly if you're told you have progressive multiple sclerosis. You're told, then we can't help you. The drugs won't work. Progressive sounds progressive. It sounds terrible. Treating multiple sclerosis. Sometimes people ask me, why do I do this? You know, why don't I just leave well enough alone? Why do I have to say bad things about what doctors do? You know, like for example, when we have patients with heart disease, why do I have to tell people that angioplasty doesn't save lives? Why don't I just go on and tell them, you know, eat a good diet and the underlying atherosclerosis heals and gets better? Why do I have to tell people that the treatment of type 2 diabetes with the pills and insulin that they use actually kills them? Why don't I just tell them what they have to do is just eat a good diet and they'll lose weight and the type 2 diabetes will go away? Why do I have to focus on this negative stuff? Well, it's because the patient doesn't listen until we get rid of all the hopes and dreams that are false. You know, if you still believe that the heart surgeon is going to save you, then you're not going to look at what really is going to make a difference. If you still believe that these diabetic pills and insulin shots are going to save you, then you just say, hey, I'll take the shots and eat my cheeseburger. But if somebody tells you the truth, and you see that you have no alternative but to change your diet, then you'll do it. It's just human nature. You know how it goes. So the reason I have to tell you about the multiple sclerosis drugs is because people with MS, doctors with MS, that treat MS, I've heard them say this over and over again. Why would we bother with one of these health food diets? We just give them our drugs. Well, the drugs are terrible. They're horrible. They cost $30,000 for the medication. The side effects are horrendous. And the benefits are questionable at best. Like, for example, the best results they can find using interferon, which is the classic drug, interferon is, the best results, this is paid for by the drug company. This is Bayer Schering Pharma that actually paid for this study. The best they can do is the absolute advantage for slowing disability with the use of the most popular medications, beta interferon, is clinically small, 8% over 3 years. And it's like, you take the placebo group and you take the intervention group, and you can see that the intervention group has just a tiny bit less progression of disease for $30,000 just for the drug. Okay, well those are the most hopeful results for the medication. Results published in June of this year. This comes out of England. And what I want to talk to you about is I want to talk to you about the multiple sclerosis risk-sharing scheme. Excuse me, I didn't make up that title. It's called the Multiple Sclerosis Risk-Sharing Scheme. It's about a scheme. And this scheme was started in 2002 because the National Health Service, which is the national medical insurance for people who live in England, the National Health Service said the drugs that we're giving people with MS don't work. And we're talking about Avonex, Beta-Seron, Rebif, those are the interferon drugs, and also Glatiramer. They said, these drugs don't work, and we're not going to pay for them. Well, the public was upset. They don't want to be cheated out of the good drugs. And the drug companies were very upset, too. And so what they did is they set up the scheme in 2002. And they ran a 2-year study. The results were finally published in 2009. And then all of the information on the scheme was let loose in June of 2010. What they decided to do, the National Health Service, the insurance company from England, is they decided that they would pay for the drugs based upon the benefits achieved. In other words, if the drugs worked well, then they would pay the drug companies a sensible, reasonable amount of money for the medications. But if they didn't work well, they wouldn't pay them as much. Let's see what they found. The study, it found that patients taking disease-modifying treatments have acquired more disability than an untreated historical control group. In that case, the manufacturers would need to pay the National Health Service to use the drugs to make them cost-effective. The people who got the drugs did worse than the people who didn't get the drugs. How often do people get these MS drugs? In the United Kingdom, 10 to 15% do. In the United States, 55 to 70% do. And in France and Germany, 40 to 50% do. This is standard therapy. It doesn't work. This is fraud. When you take people's money and you hurt them, that's criminal behavior, in my mind. But they get away with it because they got all the cash. All right, so people with multiple sclerosis, they're following false gods when they follow their doctors and their advice to give these medications. Well, let's take a look at multiple sclerosis, see if we can find out what causes this disease. One of the interesting facts that all medical students, all nurses, probably all dietitians are taught is that multiple sclerosis is rare in populations that live around the equator, and it's common as you move north and south in latitude. I was taught that 42 years ago in medical school. I'm sure every doctor in here was taught the same thing. And I bet most of the doctors and nurses and other professionals who are taught that, you're thinking, aha, it's some magnetic force. Now, that's what I believe. My son was taught that. He finished medical school 2 years ago. He was taught that. Well, we have a new theory. on why you see this, and that theory has to do with vitamin D. Okay, that's one of the current theories, is that vitamin D, lack of vitamin D, is at the foundation of causing multiple sclerosis and all kinds of other problems. Heart disease, you probably heard that. Oh, you're supposed to take vitamin D. You know, it's the root of cancer and heart disease and multiple sclerosis and arthritis and all kinds of things. Because of this relationship I just told you about. MS and heart disease and breast cancer and colon cancer, they're rare in populations that live around the equator. At least they were once rare. Populations that live around the equator. And then as people move north and south, all these diseases, including MS, become more common. Well, as you move north and south, you have less sunlight exposure, and that's where the vitamin D connects in, right? It's a confounding factor. What happens when you move north and south is this. People around the equator eat a starch-based diet. A diet of rice and corn and beans with very few animal products. As you move north and south, the diet becomes a diet heavy in animal products. That's the problem. Now, I'm not trying to say sunshine isn't good for you. It's absolutely essential for good health. But it's misleading people into thinking that low vitamin D levels in the body are the source of the diseases that they're having. And it's causing them to do something that is actually harmful, which is to take vitamin D supplements. But we're not here to talk about that. Just thought I'd throw that in. So, anyway, cow's milk has a lot to do with this when it comes to multiple sclerosis. Cow's milk is very high in saturated fat. Cow's milk is also very deficient in essential fats. Essential fats are the fats that we can't make. They're made by plants. So we have to get them from plants, either directly by eating the plants or eating an animal that ate the plants. And so you get these essential fats that we can't make, and these essential fats go to make up the nervous system, which is a very fatty organ. And so one of the theories that was put forth in the 60s, was commonly talked about in the 70s, was that the root of multiple sclerosis is a poorly formed nervous system because the baby was fed cow's milk, and so didn't have the essential fats that were required to lay down a strong nervous system. And then what happened later on in his life is some type of insult occurred, like a virus attacked the nervous system of the person. With this weakened nervous system, they developed multiple sclerosis. Or maybe it was a circulatory problem. Or maybe, like people talk today, it was an autoimmune disease where the body attacks itself. Dr. Swank wrote a paper. I just want to go over the title of this paper with you for a minute. It's really important to understand this. He wrote this published in 1954 in the journal Circulation. What he said, the title, let's just read the title together. It's Intravascular Aggregation and Adhesiveness of the Blood Elements Associated with Alimentary Lipemia. Next part of the sentence isn't important. And injections of large molecular substances, but with alimentary lipemia. Okay, so what's he saying there? He's saying intravascular, that means inside the blood vessel, there's aggregation of the blood elements, like the red blood cells and the platelets and so on. They stick together, adhesiveness. And that's associated with alimentary, gastrointestinal tract, alimentary lipemia. In other words, when you eat fat, the fat causes, lipemia means fat in the blood. So the alimentary, the fat you eat and it goes into your alimentary tract, goes into the bloodstream and causes your blood to become full of fat. Okay? So he wrote in 1954, intravascular aggregation and adhesion of blood elements associated with alimentary lipemia. And then the subtitle is the effect on the blood-brain barrier. The blood-brain barrier. Okay, you've got the blood vessel with the blood going through, and then you've got the nervous system, and between that blood and, say, the spinal fluid, you have this barrier. And what happens, Dr. Swanks is going to tell us about, and that's why I'm setting you up for this. He's going to tell us that when you eat a high-fat diet, that fat gets in your blood and causes lipemia, which causes the blood cells to stick together and clump, and the circulation to slow, and a relative hypoxia to develop. In other words, low oxygen supply, which damages the blood-brain barrier. So now that barrier between the bloodstream and the brain becomes ineffective. It's injured. That's what his paper's about.
early 50s.
Okay, can you turn up the volume?
Because we became interested in fat in this disease, we started studying the effect of fat on the circulation. We were using dogs and humans and hamsters at that time. And what we found was that after 3 hours after a large butterfat meal, you'd find the red cells starting to clump up. And in the hamster, you could, where we studied the live circulation, you could watch the circulation slowing down and sometimes stopping for a period. And so we began to think in terms that this abnormality in the plasma, which we had become suspicious of being present, we began to think that there must be something in the, which is missing in MS, or which is abnormal in MS, which prevents this clumping, and that this clumping in MS causes damage to the capillary system of the brain, and this destroys what we know as the blood-brain barrier.
All right. So what he's telling us is that here's the blood circulation prior to any meal. These are red blood cells, okay? They have a negative charge on the membrane. They hit and they bounce off each other so that the blood can easily flow. Okay, the blood's flowing rapidly, easy flow. And then you feed, in this case, this is out of a hamster cheek pouch. They didn't hurt the hamster. Out of the hamster cheek pouch, they fed him saturated fat, and the fat got around the membranes of the blood cell. And now you see the blood cells sticking together in clumps. This is called rouleau formation. In other words, you've compromised the circulation severely by feeding fat to this animal. And you can see it when you look with a microscope in their cheek pouch. Now, when you cause this change in circulation near the nervous system, what happens is you damage the blood-brain barrier. Now things can leak through that barrier. That barrier becomes ineffective. Those are actual footages from Dr. Swank. This same type of experimentation was done on people by Meyer Friedman. Meyer Friedman set up an experiment where he took people. Meyer Friedman, some of you may recognize the name. He's the fellow that did the type A, type B personality. Well, Meyer Friedman, he's actually a friend of mine. I knew him for many years. He set up an experiment where you put a microscope and you look at the whites of the eye. You know, the whites of the eye, you can see the little red blood vessels. And he took pictures of the whites of the eye, and you'll see here a section of the eye, the conjunctiva. You see very nice blood flow there. And then what he did is he fed this person one meal high in saturated fat. It was 67% fat. It was 2 eggs, 4 strips of bacon, milk, cream, bread, 2 pats of butter. Mary and I were just in the restaurant here at the Marriott having a bowl of oatmeal. I probably saw 8 out of 10 people eating a meal just like that. One meal. And here you take a picture of the same area of the eye 4 hours later. Yeah. And by the way, I want you to know that when they repeated this experiment using safflower oil, vegetable oil, health food vegetable oil, the sludging was more severe and lasted longer. Yeah, so keep that in mind. So this kind of effect on circulation, you can broaden this to lots of problems that you see. Fatigue, chest pain, angina. People who have narrowed heart arteries, it's been known for 100 years, probably 1,000 years, but it's reported in the medical literature for at least 100 years, is they get chest pain after they eat. And what medical students were taught back when I was a medical student, what they're taught today, is the reason they get chest pain is because the blood goes to the gut to digest the food and is taken away from the heart. That's not what happens. What happens is you get profound changes in the circulation. You get this sludging, this rouleau formation. If you measure the oxygen tension in the blood of people, you just take a needle and you stick it in their artery, and you measure the amount of oxygen in the blood, and you compare it pre and post meal, there's a 20% drop in oxygen content in the blood after one single meal. So you can imagine somebody who has narrowed heart arteries, when they eat and they cause a 20% drop in oxygen in the blood, and they cause all this sludging, they get chest pain. And of course, this has led to a very effective treatment for people who have coronary artery disease. When they change from the typical American diet to a low-fat diet, the chest pain goes away. This was published in the 50s and the 60s. Dean Ornish published it most recently in the 80s. This is time-honored, simple, fundamental, safe, cost-free treatment. You sludge the circulation of your brain, and you get probably problems with thinking, TIAs, and it contributes to strokes. So this, what you're seeing here with Dr. Swank's work on multiple sclerosis carries over to the rest of the body. I want to just kind of take a sidestep with you a minute. I want to talk to you about autoimmunity, because those of you who are familiar with multiple sclerosis knows it's a disease of autoimmunity. And you may know other diseases of autoimmunity, like relapsing polychondritis that Jeff was talking about Sabrina having, rheumatoid arthritis. Well, there's a whole bunch of them. I'll list a whole bunch of autoimmune diseases. In common, the story is this is a problem where the body attacks itself. I heard that probably before medical school. The body attacks itself, and I say to myself, how stupid. Why would the body attack itself? Doesn't make any sense at all. Well, there's been a lot of work done on this, and it is pretty clear why the body attacks itself. It's because the body gets injured. And the injury begins in the gut. This is the gut wall. Okay? This is the gut wall. And the gut wall is folded into what we call villi to increase the surface area of the gut wall. So you have lots of room for absorption. This is the gut right here, and this red is a blood vessel. And between the blood vessel and the gut wall, the gut where the food is and the partially digested food is, between this blood vessel and the gut where the food is, there's one cell layer thickness right here. See this one layer of cells? It covers all these villi and goes through the entire intestinal tract, all the way from your mouth, right inside your lips, all the way to the other end. This one layer of cells. Now, this one layer of cells, it does marvelous things, amazing. It's probably the smartest part of the body. When we have proteins from bacteria and viruses in our gut, these cells recognize them as being harmful and keep them from going into the body. But when we eat proteins in foods, hopefully plant foods, what these cells do is they recognize these as necessary nutrients and allow these proteins and amino acids into the body. These cells are so smart that if you eat a, quote, calcium-deficient diet, which there's no such thing, but if you eat a diet like I eat, in other words, you don't drink any milk or take calcium pills, you eat a diet of starches, vegetables, and fruits, those cells are so smart that they will reach out and take in the calcium from those plant foods and bring it in and always meet our needs. And if we do something foolish, like drink glassfuls of milk or take in handfuls of calcium pills, and those cells didn't block that calcium and keep it in the gut and out of the body, we get very sick and die. We get soft tissue calcification. If those cells allowed all that calcium that the typical American eats to go into the body, people would be dying. The heart would get calcified, the kidneys would get calcified, etc. Those cells are so smart, every medical student learns that when somebody gets iron-deficient anemia, say they bleed, that those cells become very active and increase the absorption of iron tremendously. I'll increase it up to around 20% of the iron that's in the food gets absorbed because those cells get so efficient because those cells recognize the body needs more iron. But if we don't have iron deficiency anemia, we start taking in a lot of iron, those cells keep that iron out so that we don't develop hemochromatosis, a condition where the liver and the spleen gets filled with iron and you die. Those cells are so smart, but those cells get injured and they die. They get injured by viruses and environmental toxins, and just the typical American diet will kill off a lot of those cells. One of the more common things that kills those cells is taking non-steroidal anti-inflammatory drugs like Motrin or Advil. You know, how when you take those non-steroidal anti-inflammatory drugs, the gut, you get gastrointestinal pain, indigestion, and bleeding. It's because it destroys those cells. In fact, if you take non-steroidal anti-inflammatory drugs for a while, that border can be damaged so severely that it can take up to 4 months for it to grow back. Okay, so once that cell layer, that very smart just one single layer of cells, gets damaged, those cells disappear, and now you have what we call a leaky gut. So things can indiscriminately go through into the bloodstream, into the body. It doesn't have that those cells that would otherwise protect us. Okay, so There are lots of things that are supposed to stay in the gut and not go into the body, like viruses. But say viruses get into the body. Okay, here we have a virus in the body. It's in the bloodstream. And what the body does when it sees a virus is it goes out to kill the virus. And one of the first things it does is the lymphocytes make antibodies. Make antibodies to this, which we call an antigen. It's a protein. So the body makes antibodies that attach to this virus protein and kill it. Or have other cells come in after it's attached, the antibodies have attached. Other cells come in and they kill this virus so that we don't die from the virus. That's the way it's supposed to work. You know, it'd be good if the virus stayed out of the body, stayed in the gut, didn't go in, but sometimes they break through and go in and people get virus infections. This is a protein that the body would recognize as foreign. It's beef protein. When beef is consumed, those cells that I showed you that line the intestine, they should keep beef out of the bloodstream. But if they're injured and you have a leaky gut, what happens is those beef proteins can get into the bloodstream, and the body thinks those beef proteins are a virus coat or a cell wall of a bacteria. And so it starts making antibodies to those beef proteins to kill those beef proteins that leak through that gut because there was a leaky gut present. So it starts making antibodies, and it does it also when we have dairy, for example. If we have dairy, what happens is the dairy proteins, the beta-casein, segments of the beta-casein and other proteins, with a leaky gut, they get into the bloodstream, and the body thinks that these proteins are foreign. They are. They're from a cow. And it makes antibodies against these foreign proteins. But what happens is the antibodies made aren't just to that beef protein or just to that milk protein. What those antibodies find in the body, because, you know, these are foreign proteins. These aren't supposed to be in the body. Viruses, yeah, the body knows about viruses being in the body, but it doesn't know about cow milk protein or pig protein or other animal proteins being in the bloodstream. So it recognizes it as foreign, but it also recognizes it as the same. It will make antibodies to a segment of the cow milk protein. Okay, it's like a lock and key. This is a lock and key set up here. Makes antibodies to it. But what it does is it finds similar looking proteins to what's on a cow milk protein or a beef protein or a pork protein. It finds similar proteins on our own body tissues. Similar segments of amino acids, for example. We've identified in type 1 diabetes, we've identified the 17 amino acids that the body makes antibodies to when cow milk protein goes into the bloodstream through this leaky gut. And we've also identified that same sequence of 17 amino acids present on the insulin-producing cells of the pancreas, the beta cells. So here's the scenario. The child consumes the milk. For one reason or another, the gut barrier doesn't work. The child has a leaky gut. The cow milk goes into the bloodstream. The body recognizes that cow milk as being foreign. It makes antibodies to a segment of that cow milk. We know what that segment is. It's 17 amino acids have been identified. The body keeps making antibodies to that cow milk, but when it's searching around looking for those antibodies, it finds a similar segment of 17 amino acids on the surface of the beta cells of the pancreas, those cells that make insulin. It attaches to them, and they die. That's how you get type 1 diabetes or other autoimmune diseases. So here's a whole bunch of autoimmune diseases that work by this mechanism. The mechanism, by the way, is called molecular mimicry. Mimicry as in copy. What you find is you find a copy of the molecule on the body itself. Say a copy of the cow's milk or the beef protein or the pork protein. You find a copy of that segment of amino acids on the body. So if you go to Google or you go to the National Library of Medicine and you put in molecular mimicry and these diseases, it'll tell you a story about these diseases. And some of the common autoimmune diseases are ankylosing spondylitis, Crohn's disease, dermatomyositis, type 1 diabetes, inflammatory arthritis, lupus, relapsing polychondritis, which we just talked about, multiple sclerosis, pernicious anemia, polymyositis, psoriasis, psoriatic arthritis, rheumatoid arthritis, scleroderma, thyroiditis, which leads to hypothyroidism, ulcerative colitis, uveitis, and vertigo. You've heard of these problems. Okay, they're autoimmune diseases. The body attacks itself. So let's get back to multiple sclerosis. In this situation, what we have is we have a nerve, And that nerve is covered by a special cell which is called myelin. It's a myelin sheath. It's a whole bunch of cells that cover that nerve so that the conduction is effective through that nerve. What happens is a food protein, like cow milk protein, gets into the bloodstream. The body makes antibodies against that cow milk protein. And then what happens in its course is it finds similar proteins on other tissues. Could be the pancreas, could be the muscle, or if the blood-brain barrier is damaged and that antibody, because the blood-brain barrier was damaged, then what happens is the antibody leaks through the blood-brain barrier and it attacks the myelin sheath. All right? So you got two things happening in multiple sclerosis. And as a result, what you have here's the nerve, here's the myelin cells covering the nerve. You get these cells being destroyed, and then the nerve doesn't work effectively. All right. So this is one of Dr. Swank's patients. I know quite a few of Dr. Swank's patients. This lady in 1989 was told she was in the top 1/3 of the worst patients her neurologist ever seen with multiple sclerosis. Well, she changed her diet, and she's alive and well and fully functional today. This is a fun lady. She may be here. She's not here today, is she? Okay. This lady, she lives in Los Angeles. Deb Tasek. She got multiple sclerosis in 1991. What happened is it attacked. You remember, this is random. It can attack you any place. It attacked her inner ear. And she became very dizzy. In fact, so dizzy that she couldn't get up. She had to lay on the couch. She couldn't even get up and go see the doctor. She was so sick. And so it took a month before her husband could get her in the car and take her to the doctor. Finally, her husband took her to the doctor, and the general doctor looks at her and says, "Whoa, this is way, way beyond my expertise. You must see a neurologist." So they immediately went and saw the neurologist. And the neurologist, after examining Deb, he calls the husband into the office and sits down and talks to the two of them. Now, this guy didn't have the greatest bedside manner, but he was really clear about what he had to say. Turned around to his whiteboard, and he put an X there, and he says, "That's where your condition is right now." He says, 5 years later, you're going to be in a wheelchair. 10 years later, you're going to be bedridden or dead. That's what he told her. So Deb said, that's not the way I'm going to live my life. And she became semi-vegetarian in 2000, started our diet in 2001. Her MS stopped in 2002. How do I know her MS stopped in 2002? Here's a picture of her now. How do I know her MS stopped? Well, I have her MRI reports. We'll just read the last part. Compared to 329/2000, the multiple lesions in the brain described above are slightly smaller and do not show any interval increase in size. And that's what I've seen over and over again in our patients who have active disease. This is a progressive disease. When they change their diet, immediately the disease stops. That's why I started the study. That's why I threw $1 million on the table, because I believe we can stop that disease. The Oregon Health and Science University believes it too. That's why they got involved with me 3 years ago. Most MS patients, unfortunately, they're taught the rich Western diet. You eat a well-balanced, reasonable, sensible diet. Well, the data is, and everybody hates to hear this, even the head of the Department of Neurology that I work with, he gets upset with me when I say this. But if you look at the research, this is what the research says. With the best therapies available, $30,000 a year just for the drug, with the best therapies available, half the patients within 10 years are unable to walk unassisted, wheelchair-bound, bedridden, or dead. Okay? Now, you keep that in mind. That's the best they can do. Half the patients are not functioning, or worse. Best therapies administered. All right, so Dr. Swank says, started a diet. Dr. Swank, actually the way it started was he worked in World War II. His job was tracing disease patterns in Western Europe. So in Western Europe, he observed some things that people probably wouldn't expect. In a time of tremendous stress, war, people are being incarcerated, shot in Western Europe by Nazi Germany. What he saw was people are getting healthier. Heart disease almost vanished. New cases of diabetes weren't appearing. People with diabetes stopped having complications. New cases of multiple sclerosis were not appearing. And people who had MS stopped having attacks. So the war ended, and he went to Montreal Neurologic Institute, and he started treating people who had multiple sclerosis with what he saw in Western Europe. And he developed the Swank diet. The Swank diet is a low saturated fat diet. Swank diet. Total fat is 40 to 50 grams of fat, which is compared to the U.S. diet, which is 150 to 175 grams of saturated fat. Saturated fat is 0 to 15 grams compared to 140 to 165 grams of saturated. That's animal fat we're talking about. Polyunsaturated fat, 20 to 35 grams compared to 15 to 25. There's no limit on starches, vegetables, and fruits. That was the basic Swank diet. Dr. Swank published a paper in 1990 in The Lancet where he found that a difference of 8 grams of saturated fat intake daily resulted in a 3-fold increase in the chance of dying of multiple sclerosis. Let me say that again. If you take in 8 grams of fat a day extra compared to those who don't, you have 3 times the chance of dying of multiple sclerosis. 8 grams of saturated fat. What's 8 grams of saturated fat? Well, it's one of these sausages. That's 8 grams of saturated fat. Actually, it's 10. A little burger, just one. 3 times the risk of dying of multiple sclerosis if you just eat one of those a day. Or a little porterhouse steak, or a chicken McNugget will do it. Yeah, 1. Okay, a little bit of cheese, that'll put you up to that level. An extra 8 grams of saturated fat, 3 times the chance of dying of multiple sclerosis. Or a little piece of cheesecake will do it. So it doesn't take much. All right, now Dr. Swank, with the Swank diet, this is what he reported. I'm going to tell you about this, and I'm going to have him tell you the same thing. You'll get a chance to listen to him say it. With the Swank diet, relapses decreased by about 70% in the first year of treatment, from 1 relapse per year to 0.2 of a relapse per year. 70% decrease in 1 year on the diet. Thereafter, the first year, there were continued improvements, about 5% fewer relapses per year for the next 2 years. And then for the first 16 years of treatment with a low-fat diet, the rate of exacerbation, new attacks, or decline was decreased by 95%. Now, do recall I told you just a minute ago, with the use of the best therapies available that your doctor could administer you, the chances are half the patients will be significantly or severely disabled within 10 years. Unable to walk unassisted, wheelchair-bound, bedridden, or dead. And Dr. Swank just told you that if you follow a diet, you have less than 5% chance of getting worse over 16 years. Is the sound up?
These patients were placed on diet beginning actually in December of 1948. And as I saw patients, they were added through the years. One of the first things we noticed was a marked decrease in the patient per year per patient. During the first year, there was about a 70% reduction in exacerbations, and in the next 2 years, about 5% each. And we published our first paper along about this time, at which point there was an enormous decrease in exacerbation rate. We've continued to follow the diet for follow the exacerbation rate for 16 years. Came down to a level which was about a reduction of at least 95%, and stayed down there during the 16 years, and it's continued to be that way. So you have a rapid drop in exacerbation rate, and followed then by a very low level of exacerbation going on for years. Well, what comes from this, as I see it, is a low-fat diet is very helpful. It can control the disease. If you start it early, patients can have a 95% chance of preventing disability from developing in patients over a very long period of time, 34 years, provided they follow the diet carefully. If they go off diet for any period of time, like months or so, the chances are pretty good that they will begin to get into trouble. And if they're off diet for a long time, sometimes that trouble may not come on for as long as 5 years, but then when it does come on, it comes on with a vengeance.
Okay, so why don't people comply? Well, the Swank diet's been known for a long time. Why don't people, not just with MS, but why don't they comply when it comes to heart disease or obesity? Well, Dr. Swank says, most people in this country expect to be cured by a pill, and to have a cure that is almost instantaneous. With a low-fat diet, the people actually have to work to get better and have to cure themselves. That's what he told me. One problem is culture. We are a meat and potatoes society. Most importantly, there is an economic problem. There is really not much money in a diet. Nutrition has not been taught in medical schools for many years now. That's what he told me. And then I asked him, I visited him all the time. Every time I went to Portland, I spent time with him. I got to know him really well. In fact, he ran two MS programs at my clinic when I ran it at St. Helena Hospital. One day we're sitting in his office, and I said, look, Dr. Swank, I said, all your research, I mean, you've published 176 papers. You're one of the most famous doctors in the world. There's no research that contests what you do. It all says that it'll stop this disease. I said, why is it that when a patient goes to a neurologist, the neurologist doesn't say at least something like, well, you might as well eat a healthier diet. It'll cut your food bill and cure your constipation. And hey, there's this Dr. Roy Swank who's been head of neurology for 23 years at the medical school in Portland, and he believes it'll help you, and it's not going to hurt you. Why don't you follow a good diet? Why doesn't a neurologist tell that to a patient? Or the MS Society. Go to the MS Society. When you mentioned diet and MS, or Dr. Swank and MS, words like unproven, quack, those kind of words come out. Even though they have no evidence, absolutely no evidence to suggest that what you do is not correct, and you've published in the major medical journals, the Lancet, the American Journal of Clinical Nutrition, Archives of Neurology, you've published in all the major medical journals. Why is it that they act that way? He kind of leans back in his chair and pauses a minute and says to me, and as far as the MS Society is concerned, John, they don't mention it because they didn't discover it. It wasn't their research dollars that found this treatment, so they're not going to tell anybody. I discovered it in my small office here in the basement of the medical school. I got mad. I got mad at him. I got mad at the messenger. I said, what are you telling me? I realize that money keeps people from having proper treatments. So I can understand that, but you're talking about egos. And then I'm watching this TV program, 60 Minutes, and it was about the Aeromexico crash here, right here. Remember that little airplane ran into the Aeromexico jet? That was 20 years ago or so. You guys remember it. Anyway, Mike Wallace is talking to an aviation expert and says, well, don't you have anything to tell when airplanes get close to each other, like transponders? And the guy says, you ever heard of NIH? NIH. He says the FAA has had these for over 10 years, and they're not going to allow them in the airplanes until they get their model approved. You haven't heard of NIH? Not invented here. Think about your business. NIH rules, and that's why they don't tell anybody about it. So anyway, we started the diet and multiple sclerosis study. We're seeing results. I can't talk to you about the results. All I can do is smile. It's going really well. If you know people who have MS, you should spread the word. You should tell them about this. This lecture is on my website free. So if you want to listen to it again, you want to share it with anybody, just click on drmcdougall.com, and that lecture is right up there, free. Okay, I have 5 minutes, Jeff. Yes? How do you get in the study? You have to have progressive disease. And you apply at the Neurology Department, Oregon Health and Science University. We have to have people who, the kind of people we get in the study are people that are likely going to be disabled within 3 years. Yeah, we take the real sick ones. And of course, they have to be willing to change their diet. And of course, if you apply for the study, this is a randomized control study. So you have a 50% chance of being told you must eat at McDonald's for the next year. That's one of the sad things. One of the unfortunate things is we've had people come from the control group and hear this and break down in tears and say, how could you do this to me? How could you know this and allow me to eat the Western diet for a year? Ma'am, that's how you do studies. I'm really sorry. It is unethical, but that's how you do studies. And by the way, I could be wrong. Dr. Swank's treatment of 5,000 people over 50 years could be wrong, but I don't think so. Yes?
My daughter has MS, and she has the intermittent type. She's had it maybe 10, 15 years. She's been treating with interferon, and at the same time, I'm a very strong nutritional, I give her a lot of advice. She goes in and out of vegan diet. And My question is, she asked me to take notes today. My question is, since she started with the interferon, is it something she can get off? I mean, she's got that medical orientation.
Okay. First of all, I'd show her the lecture. It's free. It's on the website. I would take her to my January 2009 newsletter where all of this is written with all the scientific references. So just go to my website. Anybody who is taking these drugs, including the people that I see, one of the problems I have with the study is I have to tell them to stay on their drugs. I mean, I have to do a lot of things I don't feel good about. But what I tell people who have MS is I tell them, gather the research. You know, go look up the scheme. It was published in the British Medical Journal just a couple of months ago. Go look it up. Sit down with the doctor and say, what about this scheme? You know, the National Health Service showed that people who take the drug do worse than the historical controls. Let's look at your research papers. Let's see what you can do. As massaging the data the best you can. You guys paid for it. You guys controlled it. You know, and believe me, there's a lot of dishonest things that goes on in research if you don't know that. And the best you could do is to show a measly, almost undetectable clinical benefit. You're charging me or my insurance company $30,000. Sit down with her doctor and make her doctor look her right in the eye and say, well, that's not the case. Here, we have all these studies. Let's see the studies. That's what the research says. So that's a matter, I mean, that's a whole separate thing. The drug therapy is totally separate from diet. People who are on the drugs should be following the diet. People not on the drugs should be following the diet. You don't say, I'm not going to take the drugs because I'm following the diet. You say, I'm not going to take the drugs because they're expensive, they have serious side effects, and they don't work. That's why you say it. Not because you say, well, you know what I get. You separate the diet and the drugs completely. You don't want to get the conversation mixed up. The doctor will go, oh, another health food nut. You say, no, doctor, let's talk. You justify it. You're asking me to take these. You justify for me to take these. Show me the data. And I know what she's going to see. I've got all the research. It's a horrible thing that's going on. But it's no more horrible than doing angioplasty on heart patients. Same crooks. You know, it's no more horrible than giving type 2 diabetics insulin and diabetic pills. This is a Vandia scandal that's been going on for the last 6 months. These guys are crooks. And I'm sorry, I know you probably don't think it's very nice for a doctor to say that about a doctor. But that's just the way it is. Yeah.
A question. Is there at any point with an MS patient that it's too late as far as with the diet?
Whatever's been lost, you will not get back. Okay, whatever that has been killed by those attacks will not come back. Is it ever too late? No, it's not ever too late. I mean, there may be the point where the patient says, life's not worth living, but that's a personal decision. You are not going to get people out of wheelchairs and get them walking by doing this, unless they lose 50 pounds and they're barely able to get out of the wheelchair. You cannot reverse what's been lost. And with age, people deteriorate. They just deteriorate with age. But you can stop the disease. I believe you can stop the disease.
Have you had any experience with Cadacel in the diet?
I'm sorry, say again?
Have you had any experience with someone with Cadacel in the diet?
I didn't get the word.
Cadacel? It's an acronym. It's similar to MS. My stepmom has it, so I'm asking for her.
I don't know that.
Okay.
But
see you later then.
I would even treat earwax with a healthy diet. and by the way, I've seen good results. It just makes no sense at all. Whether you know what's wrong or don't know what's wrong, you want to be as healthy as possible. And you want to be healthy.
Okay, we have time for one more question.
You talked about the mechanism being the body thinking a protein is foreign and attacking it. But Dr. Swank recommends reduction of saturated fat. So what's the connection between those two?
Between saturated fat?
And why does saturated fat reduction help slow the disease, where it's really the protein that the body is attacking?
I'm not sure I understand the question, but the reason he focused on saturated fat is that's what he had learned, in his experiences during World War II. That's what he picked as a diet. He didn't focus on polyunsaturated fats at all. Dr. Swank and I have had many conversations. I want to make two statements here. One is that we talked about getting the polyunsaturated fats out of the diet, which I do, because I think they're very unhealthy. He doesn't think it made any difference when it came to the progression of the disease. He gave them to people because he felt it made the diet more palatable. That's the only reason. Not because it slowed or changed the attacks. The second thing I want you to know is I asked Dr. Swank on several occasions, I've got this recorded. You notice these are home movies that I took. I got this recorded, and I asked him, how often does the diet fail? If somebody follows the diet, how often will you not stop the disease? One time he told me 1 in 200 times. The other was 1 in 500. He went to China. He was invited by the Chinese government to look at MS patients in China. I mean, he was a very famous man, and the government invited him to see MS patients in China. He told me, and I've got this recorded, it's so funny, he says, they brought out 5 people with MS. He says, I don't think they had MS. That's all they could find in China. Okay?
Thank you very much.
Thank you.